Every single day, thousands of people lie back on an operating table, count backward from 10, and just slip quietly into a void. They are completely unaware of the major surgical trauma happening to their bodies. Honestly, it's one of the greatest physiological mysteries, and for sure one of the biggest medical triumphs of our modern age. Welcome to this premium medical explainer, brought to you right here on Pharmacy with Sabir. Today, we're breaking down the architecture of unconsciousness. We are going to explore the exact science, the precise pharmacology, and the incredibly intricate brain mechanics behind general anesthesia. So let's dive right in and tackle the biggest question of the whole process. Where do we actually go when we go under? There's a really common misconception out there that general anesthesia is just going to sleep. But as you'll see throughout this explainer, you are definitely not taking a nap. General anesthesia is a profound, meticulously calculated pharmacological disruption of your entire brain network. You aren't resting at all. Your brain's ability to process information, form memories, and perceive pain is literally being systematically intercepted.
Section 1. The spectrum of sedation.
Now, not all anesthesia is created equal. The contrast between our options is actually pretty stark. On one side, we have local and regional anesthesia. This is where you might be totally awake, but a very specific nerve pathway is blocked. Think of getting an epidural during childbirth or a numbing shot at the dentist. You're awake, the numbness is highly targeted, and you're pain-free. But by contrast, general anesthesia is a total system shutdown. The patient is rendered completely unconscious, experiences total amnesia, and is medically paralyzed. That stark contrast really lays the foundation for why general anesthesia is so complex and why it requires such vigilant management. Section 2. Inside the anesthetized brain. So like we said, general anesthesia is not sleep. It is a meticulously controlled, reversible coma. I really want that to sink in for a second because it completely raises the scientific stakes of what we're talking about here. Anesthesiologists are essentially pushing a patient to the very brink, holding them in this suspended state of extreme physiological suppression and then safely pulling them back. It's an immense medical responsibility that requires just unbelievable precision. To protect a patient from the extreme physical trauma of surgery, we rely on what we call the triad of anesthesia. We have to hit 3 simultaneous clinical goals. First, hypnosis, which is that profound unconsciousness and amnesia. Second, analgesia, meaning the complete absence of pain. And third, akinesia, which is muscle relaxation or paralysis, so the body doesn't reflexively twitch or move during the surgeon's delicate work. These 3 pillars have to be perfectly balanced. Section 3. Pharmacology, the molecules of sleep. All right, let's get down to the micro level and look at the chemical agents doing the heavy lifting here. First up is the GABA receptor. You can think of the GABA receptor as the main biological brake pedal for your central nervous system. When this receptor is activated, it floods the neuron with negatively charged chloride ions. This effectively hyperpolarizes the cell, which is just a fancy way of saying it slows down and silences neural signaling. It literally stops brain cells from talking to each other. And this is where our primary induction and maintenance agents come into play. Drugs like propofol, which is famously called the milk of amnesia in the clinic because of its milky white appearance, and inhaled gases like sevoflurane work by seeking out these GABA receptors. When they bind, they essentially stomp that brake pedal straight to the floor. They supercharge GABA, amplifying the brain's inhibitory signals so intensely that consciousness shuts down completely and no new memories can be formed. But hey, remember our triad? We also absolutely have to block pain. And that requires targeting a totally different receptor, the NMDA receptor. Unlike GABA, which is inhibitory, the NMDA receptor is excitatory. It acts a lot like the brain's gas pedal, and it's a major pathway responsible for transmitting pain signals and helping to form memories of traumatic events. To shut down that pain, we can use a drug like ketamine. Ketamine acts as an NMDA receptor antagonist. It blocks this receptor, stopping pain signals dead in their tracks well before the brain can process them. And here's a really great clinical pharmacy pearl for you. A practitioner might choose ketamine over other painkillers because, unlike a lot of anesthetics that completely tank a patient's blood pressure, ketamine actually helps maintain hemodynamic stability. It provides this profound pain relief while keeping the heart pumping strong, which is an absolute game changer in trauma situations. Section 4. Monitoring the edge. Now, because the brain is locked in this drug-induced coma, the body kind of forgets to do the basics, like breathe or regulate its own blood pressure. So the anesthesia machine and all those glowing monitors you see in an operating room become the patient's literal lifeline. We rely on continuous vital monitoring. We're tracking heart rate, blood pressure, oxygen saturation, and respiratory rate. Every single beep, every waveform is constantly evaluated by the anesthesiologist to ensure oxygen is reaching all the vital organs while the surgical team does their thing.
Section 5. Recovery, Myths, and the Future.
Let's finally put an end to that myth we brought up earlier. When the surgery is over, you are not waking up from a deep, refreshing rest. The evidence-based fact, as we now know, is that your brain just endured a massive pharmacological disruption of its networks. You aren't waking up rested. Your brain is actively trying to reboot and reconnect all of its communication pathways after being completely chemically suppressed. Because of that intense systemic reboot, patients often experience temporary side effects when they wake up. It's incredibly common to feel nauseous, dizzy, have a sore throat from the breathing tube, or experience some temporary confusion or delirium. This is totally expected as the drugs clear your system, and clinical teams are highly prepared to manage these symptoms in the recovery room to keep the patient as comfortable as possible. On a physiological level, this wake-up sequence happens in very distinct stages. First, the anesthesiologist cuts off the administration of the anesthetic gases or IV drips. Second, as blood filters through the liver and kidneys, those drug molecules detach from the brain's receptors and clear out of the bloodstream. Third, the autonomic, involuntary functions come back. The patient starts breathing on their own and their natural reflexes kick in. And finally, step 4, higher cognitive function and consciousness reemerge. It really is a beautifully orchestrated chemical withdrawal. And you know what? The science behind this is only getting better. The future of anesthesiology is rapidly charging toward precision medicine. Instead of standard dosing based mostly on body weight, we're seeing the rise of real-time EEG brainwave targeting and customized neuromonitoring. This allows anesthesiologists to see exactly how deep an individual's coma is in real time. They can tailor the drug delivery milligram by milligram to ensure the safest, most effective, and absolutely fastest recovery possible. The architecture of unconsciousness is honestly a total marvel of modern medicine. But as we move toward mapping the precise brainwaves of the human mind in real time, it leaves us with one pretty haunting question. If we can so easily dismantle and rebuild human consciousness with just a few molecules, what does that actually mean for our understanding of the self? If you found this breakdown fascinating, please hit that like button, subscribe to the channel, and drop a comment below with your thoughts or questions. Stay tuned right here to Pharmacy with Sabir for more premium evidence-based medical explainers. Until next time, stay curious.